Hi, this is Sarah Benjamin, and we are moving on to um, drugs for seizure disorders. So let's talk about drugs for seizure disorders. We talk about focal onset seizure disorders. So those are talking about how the onset is. Onset is how something starts. So there's focal onset and generalized onset. So focal means there's a focus or there's a specific part of the brain that is to blame. Generalized means it's all over. So when we talk about focal onset seizures, we talk about focal aware, focal impaired awareness, focal to bilateral tonic-clonic seizures, and then the generalized ones, we look at absence, atonic, myoclonic, tonic-clonic, status epilepticus, febrile. We talk about a lot of things that can happen. Now, honestly, really and truly, there is this continuum. There's some degree of focal. It can go also to some degree of being very generalized. It's not that it's always one or the other in onset, but focal versus generalized, again, it's talking about focal onset versus generalized onset. Okay? Anti-seizure drugs work in a variety of ways. The effects of the anti-seizure drugs are that they suppress the discharge of neurons within a seizure. Okay? They suppress the propagation of that seizure activity. So they suppress the discharge of neurons and then the propagation of more discharge from those neurons. So one way that they work is they can suppress sodium influx. They can suppress calcium influx. And then they can antagonize glutamate. Or they can potentiate GABA. GABA is this nice little neuronic suppressor, right? So if we potentiate GABA, it can suppress these seizures. If we antagonize glutamate, then ultimately we're allowing GABA to work better. Suppression of that calcium influx and suppression of that sodium influx. We're decreasing the changes that occur across the plasma membrane, making it less likely that electricity is going to fly through those neurons. So we just want you to know that there's a Lennox-Gastaut syndrome where there's a severe form of epilepsy. It can occur in the preschool years. It involves a developmental delay and a mixture of different types of seizures, both focal and generalized onset. When people get treatment for seizures, we want to reduce those seizures to a level that lets that patient live as good of a quality of life as possible, as normal a life as possible. We want to balance, we want to look at the positives and negatives, and we want to really balance complete seizure control with acceptable side effects. A lot of these have central nervous system depressing qualities that aren't really desirable, and there are other side effects as well. I will attach a few additional videos for anti-seizure drug specifics.